Today is World Diabetes Awareness Day. It's also an opportunity to raise awareness and provide education concerning the disease. Health reporter Haley Hernandez is joining us now with a local doctor to talk about prevention, diagnosis, and treatment.
Yeah, I mean, all very good things. Dr. Archana Sadhu is an endocrinologist and the director of the System Diabetes Program at Houston Methodist Hospital. Thank you so much for coming in and talking to us about this.
It's a great pleasure. Thanks for having me.
I mean, I wanted you to come back. You were in our story this morning at 6:45. I wanted you to come back because I can tell that you're passionate about this, and I can tell that you want more people to know the signs and symptoms of diabetes. Can you talk to me about that?
Yes, so first of all, I'd like to say that we really need to have patients educated before they have signs and symptoms of diabetes. So knowing your risk for diabetes is the #1 tool we're trying to enforce and teach everyone about, especially on a day like this. However, if you start to have symptoms, you'll usually notice increased urination, increased thirst, I mean, to the point where it seems very bothersome to you that you are going much more often than usual. Fatigue and weight loss are also very common. So if you're having any of those, please seek medical help for evaluation immediately.
And are those symptoms for both type 1 and type 2?
Yes, because they're all related to having very high levels of glucose in your blood, and that's the manifestation of high glucose levels.
Yeah, so I know a lot of times when we talk about diabetes, because type 2 diabetes is growing so rapidly, but really, truly, the symptoms are the same and the management would be similar because it's using insulin to manage the disease, right?
Well, for type 1, insulin is it. You must have it because your body does not make it, and it is a necessary hormone for existence, for life. For type 2, though, we have had increasing number of medical options, new drugs, new classes that can be used for type 2. Many type 2s often go on to insulin, especially if they're advanced in their disease. So being on insulin doesn't really designate the type of diabetes all the time, but much more options for type 2 than type 1.
Can you tell me how somebody would get tested for this? I mean, we're seeing video of people, taking their blood sugar. Is it as simple as that? Could somebody do it at home and know if their blood sugar was not, working normally?
Well, a lot of patients come to me self-diagnosed because they used their grandma's machine or a family member's or friend's machine because they weren't feeling right and saw this high blood sugar. That's not ideal because that's really far into the disease process. You should get medical evaluations regularly, especially if you are at risk. So how do you know you're at risk?
Yeah.
There are some simple things that you can do. I really highly recommend your audience to go to diabetes.org. And the American Diabetes Association has posted a risk calculator. Very easy. Within 30 seconds, you'll know if you're low, medium, or high risk after answering just a few questions. And of course, if you're at risk, you should then seek medical evaluation. And often we do a blood test to look for the hemoglobin A1C as a diagnostic test.
What would some of the risk factors be? I mean, would it be weight and family connection? Like, what are some of the risk factors that you're looking at?
Exactly. First and foremost, easy to find out is, do people in your family have diabetes? That already puts you at higher risk. Certain ethnicities are very high risk as well. And then, as you mentioned, weight. Are you optimal weight? Are you overweight or even obese for your height? Because that increases your level of risk. Age is another one for type 2 especially. So these are all risk factors that are very obvious and easy to find right around you. For type 1, it's a little bit more complicated. That's more of a genetic mutational disease and multiple, actually, causes for type 1. And that's harder to identify unless you do have a family history, then you should get further evaluated.
But with both type 1 and type 2, it can lead to the same complications, right? Kidney disease. Can you tell me some of the...
Right. Despite the reasons for the diabetes or the etiology or why it's caused, the end result is a high blood sugar. And high blood sugar can really damage your body from head to toe. I always say strokes in the brain, blindness in the eyes, heart attacks and heart failure, liver failure, kidney failure, all the way down to the feet of amputations. So it really does affect every part of our body, and prevention is very key, especially for type 2. And even for type 1, we're really advancing in science. And if you have a family history and you get tested and you're determined to be moderate risk, We can actually give you a drug now that was just approved recently to delay the onset of type 1. So a lot of exciting things happening in the science of diabetes to help our patients.
Yeah, actually, we heard from your patient earlier today, Marjorie Hunter, who's, by the way, had all of the complications that you just listed, because she's had diabetes type 1 for 50 plus years. And she was, you know, as terrible as the disease has treated her, she's still such an advocate for scientific advancements like that. And I'm so happy that it's coming. I would say that it's probably not coming fast enough.
It's very slow. I really agree with that statement. We hope to find more and more information and eventually a cure. It is progressing, but it's a complicated disease. It's not just one thing wrong. There's many variables that go into diabetes, and we're teasing them out one at a time, slowly but surely. It's been, in my career alone, the number of therapies and what we've learned about diabetes has really logarithmically increased. So I'm very excited for the near future.
I think with so many people now having type 2 diabetes, everybody knows somebody with diabetes. So when it's becoming a little more common like that, people don't really take it as seriously. So thank you for coming on and explaining that this disease has very serious consequences and can even be deadly in some cases. So tell me, what can people do today at Houston Methodist to get checked out or talk about managing their disease?
So at Houston Methodist, we have a great diabetes program. And one of the things we do, not just taking care of patients who have been diagnosed, is actually raise awareness and education. So at all of our Methodist hospitals today in the lobby, we will have many medical professionals available for the public to come and learn about diabetes, how to prevent diabetes, how to manage diabetes, and just how to live with this daily disease. So I encourage your audience to find a Methodist near you and just walk in, no appointments needed, to come and learn about diabetes.
Great, no appointments, and it's free to show up.
Free, completely free,
Love that.
and very professional clinicians and educators there to answer all your questions.
All right, before I let you go, I know you're very passionate about prevention too. So what do you want people to know about preventing diabetes?
Well, for type 2s especially, it's really not rocket science. Live a healthy life. And by a healthy life, I mean eat fresh fruits and vegetables, lean meats, avoid the processed high carbohydrate, high sugar, high salt foods. That goes a long way. And be good body weight for your height, and that means regular physical activity. The way our lifestyles are now, we're often in cars, sitting in chairs and couches, and it really is not how our bodies should be. So make sure you're moving as much as possible and dedicate just 30 minutes a day to being physically active, and that will reduce your risk of diabetes tremendously for type 2.
Get moving.
Get moving.
All right. Dr. Sadhu, thank you so much for coming in and joining me this morning. I appreciate your time.
Thanks you for having me and raising awareness on this very important day.
Yeah, it's World Diabetes Day. Zach?
Ladies, a lot of good information.